In this video, we're going to look at the topic of osteoarthritis. This video is a bird's eye view of osteoarthritis, covering topics like what is osteoarthritis, understanding it, diagnosing it, the treatment and management approach of osteoarthritis, and at the end I'll cover the 3-factor approach to osteoarthritis that you have to be doing. Hi, my name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin. If you like evidence-based practical content to help with pain and injury, please like and subscribe and share with someone who needs some help. Osteoarthritis is the naturally occurring aging process that happens to all our joints. It's estimated that over 500 million people worldwide suffer from osteoarthritis. It doesn't affect some people in terms of experiencing pain, while pain can completely disrupt other people's lives. The most common joint to be affected by OA is the knee, with the hip being the next most common. People can also get OA in the hands, spine and feet. Traditional thinking is that OA is a wear and tear disease from increased load on joints leading to cartilage loss. New evidence overwhelmingly tells us that this is a disease that affects the whole joint, the labrum, cartilage, subchondral bone and the muscles, and that it's not a wear and tear disease. It's not as simple or straightforward as that. Contrary to popular beliefs, a lack of physical activity is actually a big risk factor for OA. Other health conditions or comorbidities are very common with OA sufferers. It's unknown whether these just coexist or whether one leads to the other. But things like diabetes, cardiovascular disease, asthma, cancer, low back pain, mental health issues sometimes exist alongside OA, and it can be a major burden in people's lives. All of this leads to people being afraid to exercise because of either their OA, their cardiovascular disease, or the narrative that it's a wear and tear disease and they need to protect their joints. But in reality, they need to be exercising. It just needs to be extremely tailored to suit that person and their current starting point and their lifestyle situation. You can actually reverse muscle and bone changes. Even in end-stage OA, a high-quality tailored fitness program can significantly delay the need for a joint replacement. Osteoarthritic symptoms can vary hugely from person to person. It could be as minimal as morning ache and stiffness that goes after 10 to 15 minutes of just moving around, to someone else having constant excruciating pain on every step and being unable to sleep because of the pain. One of the reasons for this is the extent of damage in and around the joint itself, but it's also because pain can vary from person to person for a multitude of different factors. Pain is complicated. We know that things like your mood, your optimism and outlook, stress levels, thoughts, feelings and emotions, as well as your fitness levels, your lifestyle, nutrition, your work-life balance, smoking, fear and avoidance, anxiety, these can all impact pain levels. So the pain you experience is real, even if others aren't affected as badly. And while there is very strong evidence for the best approach to treating and managing OA, the approach that works for you might differ to the approach that works for someone else. You need to take ownership, you need to be open-minded and realize that there are things that you can do that will positively or negatively impact your own experience. You have some control. It does come down a little bit to your own attitude and your outlook. Osteoarthritis should not be diagnosed solely on imaging findings. It needs to be a clinical diagnosis, not a radiological one. So to be clear, an X-ray shouldn't be the only thing used to diagnose osteoarthritis for several reasons. The first reason being the link between imaging and pain is very poor, especially if that pain has been there for more than 3 months. For example, you can be suffering with a lot of pain, but the X-ray scan is clear. Your pain might also be due to other factors, but then when your joint is scanned, osteoarthritis shows up. So it's not as straightforward as it showed it or it didn't show it on a scan. Number 2, most asymptomatic people, so people with absolutely no pain over the age of 40, have osteoarthritis on scans. X-ray results most likely won't change the treatment outcome, and the best approach is always a conservative one first, which we will look at in a minute. And number 3, X-ray findings can be interpreted very differently by health professionals. This is actually a huge issue. The results are often poorly explained to people as well. This can lead to unnecessary fear, worry, and negative behavioral changes, which all impact the experience of pain. When I say osteoarthritis is a clinical diagnosis, not a radiological one, you can use the following cluster of signs and symptoms as a strong predictor of OA. So, being over the age of 50, having morning stiffness for more than 30 minutes, having joint line soreness, crepitus during movements, that sort of noise with it, and bony enlargement around the joint. That's especially obvious in the knee. Treatment and management of OA. The gold standard evidence-based treatment approach involves 3 areas. Number 1, education and advice. Number 2, exercise, both resistance training and cardiovascular training. And number 3, weight loss if appropriate. Other adjuncts to this foundational treatment include heat, painkillers, anti-inflammatory medication, manual therapy, steroid injections, assistive devices, and surgery. Unfortunately, these adjuncts are what often is recommended by health professionals as a first line of defense against OA, but these should purely be add-ons to your core 3. So the core foundational treatment approach for osteoarthritis. Number 1, cardiovascular exercise. Walking, cycling, swimming can improve pain and reduce stiffness while also improving mood and general health. Number 2, strength training. This needs to be both body weight and with added external load. It needs to be done gradually and consistently, but it also needs to be progressive over time. This is usually the area most people need most support and guidance. And number 3, weight loss. This works in 2 ways. A, to reduce mechanical pressure on the joint by losing weight, which is an obvious one. Decreasing body mass by 10% can improve pain by up to 50% in some people. But also point B, the second way weight loss helps is because obesity is now recognized as a low-level inflammatory state that predisposes people to other health conditions. So increased inflammation increases the risk of high blood pressure, diabetes, cancer, stroke, and cardiovascular disease. That's a lot of information in one video. So to summarize the key take-homes, the first line of defense against OA is education and advice, exercise and training, and weight loss if appropriate. Anything else should be add-ons to this core foundational 3. If you have any questions on any of this, please feel free to comment below and we'll get back to you.